Okay, thank you everyone for signing on and joining us for the Economic Forecast Project's second webinar. For those who attended our first webinar, the format will be the same. For those that are new, I will explain sort of the rundown here in real quick. So we have a nice group of panelists who Dr. Peter Rupert will introduce. We will hear from each of them for about 10 to 15 minutes, followed by a Q&A session. So we have disabled some attendee settings to prevent any disruptions and guard against Zoom bombers, if you will. For example, we have muted all attendees and you are not able to share your video. So if you're worried that that might be an issue on your end, rest assured it's not. That's intentional. We've also limited the functioning of the standard chat box. In particular, we have removed the ability for attendees to chat with one another, again, just to guard against any unwanted disruptions. Finally, throughout the presentations, if you have any questions, you should see a Q&A tab in your Zoom window. Feel free to submit any questions you'd like to that Q&A box, not the chat box. Again, please submit any questions that you might have to the Q&A box, not the chat box. One of my colleagues, Travis Saronic and Daniel Cullen, who also work at the Economic Forecast Project, will be monitoring the Q&A box. And once we get to the Q&A session, they will do their best to ask as many questions as they can. We apologize if we don't get to your question. There's nothing personal. We have quite a few, several hundred attendees, in fact, and so we'll do our best. So without further ado, I'd like to introduce someone who I think we all know and who's a real asset to the Santa Barbara community and has done a lot of work to really put these webinars together. The Executive Director of the Economic Forecast Project, Dr. Peter Rupert.
Great, thank you very much, Charlie. I want to say thanks to Charlie, Travis, and Daniel, who have worked hard also to put all this together. It's very much appreciated. Thank all the sponsors. Without them, we wouldn't be able to do any of this. And thank all the participants who are on and listening. Our goal is to provide information unbiased, to let people know exactly what's going on with the latest data that we have, trying to get an understanding of how this is affecting all of us. As we know, things are changing by the minute. And so, you know, daily things change, which makes it very difficult to get the information out there. And we plan to do more of these over the next month or so. So now I'd like to introduce Dr. Lynn Fitzgibbons, who was on last time, gave us an update as to what's happening on the health end of things here in Santa Barbara. Dr. Fitzgibbons.
Thank you, Peter. Let me get my screen set up. All right, thank you. So, participating in this forecast project last month was a real, I think, milestone in my own experience through this epidemic, through this pandemic. I opened last time with a gratitude, and I wanted to do the same. The experiences that we're having on the medical side, as well as on the economic side, on the social side, and quite frankly, within our homes, is of course unprecedented and quite extraordinary. I think the Santa Barbara community is a unique and special place for so many reasons. But one of the reasons I think is the opportunities that we have today. I learned a tremendous amount last time from Peter and the incredible expert panel last time. I'm looking forward to the same today. I'm very happy to give a quick preface with regards to what's going on medically with this disease. But I wanted to first pause and I think remind us all that the fractures that we're seeing around the country as the tensions rise, as the suffering intensifies, I think are obviously horrible to watch. I think that the efforts today with this panel getting us all really, I think, shoulder to shoulder, recognizing that not one healthcare provider, not one public health official wants there to be one more job lost. And similarly, I know that those of you on the business, policy, economic side of this similarly don't want there to be one more life lost. And so I think as we look ahead, I think keeping all of those goals in mind and doing what we can to support one another, moving in the same direction is what I hope this forecast will do, or this webcast will do. So let me quickly buzz you through what I think would be good for us all to know with regards to COVID-19 in our community. I've updated these slides as recently as 1 hour ago. I'm going to take you through the state of COVID-19 in Santa Barbara County, some testing information with regards to the two primary types of testing that we're talking about. I'm going to mention some treatment updates and then have a couple of closing comments. We are absolutely inundated with dashboards. It is remarkable how many data-filled dashboards we have. This one is available to us from the California Department of Public Health, and this is, of course, giving us a summary that many of us have seen with regards to the total number of cases, total fatalities, as well as some more granular data. Here in Santa Barbara County, we also have an excellent dashboard by our Public Health Department, and this is the updated numbers as of today. Here we see the location of confirmed cases, and those of you who have been following this, those of you perhaps in the media who are following the media reports closely, of course know that the news as of last night was that there was a big surge in the federal prison reported patients. And so just to remind everyone, for about the past month, we have had an ongoing outbreak at the Lompoc Federal Corrections Complex. The FCC is comprised of two different distinct campuses. There's the FCI as well as the USP. And both of those campuses, both of those facilities do have an ongoing outbreak of COVID-19 disease. Many are aware, and I'm not going to go through the details of what's going on and the efforts that have been undertaken, and the exciting news this week of some improved facilities to take care of inpatients up at the FCC. But what really changed yesterday with our epidemic was that we now had, I think, between 65 and 70 newly reported cases in that facility just yesterday. I want to make sure that everyone understands that that is primarily related to the Bureau of Prisons expanding their testing on that site. They announced that they were going to do that earlier this week. And I think that, again, the outbreak is ongoing up there, but there was a big increase in cases at the Lompoc FCC yesterday, perhaps more representative of increased testing in the facility rather than a big surge in cases. I won't go through every other geography, but let people know that it's available. And I'm asked often about really age and this disease. Santa Barbara County has really seen the same fairly normal shaped curve as the rest of the world. Remember that COVID-19 is very interesting in that it really primarily seems to be diagnosed in people in the middle years of life. And so to say that again, remember that the Chinese data, the European data, the US data is showing us that those in really adulthood in general are being diagnosed with this disease. That is a different statement than the statement of who is suffering the worst complications and the most mortality. And of course, that is primarily those later in life, although certainly not exclusively. What about our local deaths? Again, this is available on the dashboard, but here we see there, of course, has not been a cluster geographically, but really most of our county has unfortunately and tragically been touched by death in this disease. And again, more data that's available from the county. We have here recovery status. And so we have essentially in the orange, those who are being cared for in the hospital. In the blue, we have those who are recovering at home. And in the green, again, this really swelling number is the reassuring number that I continue to tell people who are newly diagnosed, which is that even though we have deaths and even though we have severe disease, we really do have a larger and larger number every day of people who have had this, have suffered with it, but are now better. So what's going on at the local detention correction facilities? This is, again, all publicly available information. The USP, as of yesterday, reported 34 inmates and 10 staff. And the FCI, again, prior to the change yesterday, were reporting 52 inmates and 10 staff. I'll also mention that Santa Barbara County Main Jail had a reported confirmed inmate. There was a press release on this last month, but there is not an outbreak at the Santa Barbara County Main Jail. So what about testing? So remember that testing is based primarily on this thing called the PCR test. And the PCR test is where we take a swab, and we swab usually the respiratory tract, somewhere usually in the front of the nose or in the back of the nose, called the nasopharynx, or deep in the throat in the oropharynx, or even in the saliva itself. And we look for not whole virus, but we look for little pieces of the virus RNA. And we look for that using a technique called a PCR, a polymerase chain reaction. For all purposes locally, as well as most purposes, epidemiologic purposes around the world, for someone to have a confirmed case, they must have a positive PCR. And when I showed you the county data, the state data, those are all based on positive PCRs. However, the PCR is not perfect. In fact, we have reason to believe that it may miss perhaps 25 to even 40% of cases. This may be that the test itself is limited, but it also may be related to the disease. It may be that somebody with bad pneumonia may not have a lot of this virus up in the back of their nose. Or it may be that if we're only swabbing the back of the nose and someone is shedding mostly from their throat, that we won't capture it. And so our hope is, as this epidemic goes on, that we really do develop better ways with improved sensitivity to detect this virus. But I really want to reiterate the point that we are relying on PCR to confirm cases, and yet there are still cases that we may suspect based on the imaging, based on the clinical judgment, meaning someone has the signs and symptoms of this. They have a CT scan that shows a very classic pattern, and they may have a negative PCR, but we on the medical side of this, seeing these patients in the hospital, we may decide that that patient still is a suspected case and take care of them, again, in isolation, and give them all the treatments that we ought to. So where can we get PCR testing in Santa Barbara County? Really, for the last several weeks, some medical offices and clinics have been heroically offering collection on site. The problem with a small medical office or even a large multi-specialty medical office offering collections is that anyone who's going to be collecting samples, doing these swabs, has to be wearing personal protective equipment, has to themselves be protected. They also have to have the actual swabs. And so these have certainly been limiting factors in our ability to really collect tests throughout our community. Pacific Diagnostics Lab has opened a collection site adjacent to Goleta Valley Cottage Hospital. And to have a collection done there with, again, excellent use of PPE and really rigorous infection control practice, patients would have to have a doctor's order and an appointment. This is also where Cottage Health is doing the majority of our pre-procedure and surgery testing for patients who do not have suspected COVID, but as of last Monday are now coming again into our hospital to get a procedure that was deemed elective. Before they come in, within the preceding 3 days, we are doing a swab to confirm whether or not they have this virus, even if they have no symptoms. And again, the PDL collection site has just been tremendous to be able to use for that purpose too. Probably the biggest news of today, though, with regards to PCR testing, which again is the way that we are trying to confirm whether someone has this disease, the biggest news of the day is the announcement by the health department that we have community-based testing now in place. This is a partnership between our Santa Barbara County public health officials, between the state of California, and OptumServe as a vendor. This was started earlier this week in Santa Maria at the Fair Park with the hours as outlined. And I believe it went live today. I heard of people who had appointments scheduled today at Earl Warren Showgrounds, and tomorrow anticipated to be open in the Lompoc Anderson Park area. The appointments are necessary before a swab can be collected, and information can be found on the Public Health Department website. A patient goes through an online form or a telephone questionnaire to apply to get a test. If a test is taken, insurance is billed, but there is no copay. And if there's no insurance, the state of California will cover the cost. The language that's being used as these collection sites are being rolled out for community-based testing is that everyone is eligible to apply for screening, but prioritization is going to those who have symptoms or are in higher risk populations. So specifically, they list those who are first responders or those who are healthcare workers. So serologies, the S word. So serologies are the principle where we use a blood test to check for antibodies that are made by the immune system to fight an infection. When I had chickenpox as a child, after I completed my chickenpox infection, my body learned how to fight chickenpox. And so I now have antibodies in my blood that were made to fight this infection and now persist to help me if I ever bump into varicella infection again. The concept here is that after someone has been exposed to COVID-19 disease or the SARS-CoV-2 virus, which causes it, after you've been exposed, your body learns to recognize that infection. And part of the way that we know a body recognizes an infection is we check for specific antibodies. And this is the principle behind serologies. I feel that this has absolutely tremendous potential to help us inform policy as well as risk stratify people who maybe have already had this infection, those who have not, and perhaps even inform us of an individual's relative risk. It may even help us downstream with regards to deciding who we feel may have protection and may be safer to be exposed to a general public population as opposed to not. But I want to be very, very clear that as of today, May 7th, this is really not yet ready for prime time. And what I mean by that is we do not have evidence that a positive antibody is the same as being protected. I use the example of chickenpox. We have decades of good data with regards to this exact question for that specific virus. We do not yet know whether, even if someone has had this infection, has antibodies, have a positive serology, we do not know that they are now immune or protected if they see that virus again. We also worry that there could be false negatives. It takes a body, as you can see here, some number of weeks actually to start to get the IgM is your first antibodies that rise, and your green is your IgG. It takes some time for these antibodies to start to be produced and then to get to a level that we recognize it. Finally, we worry a lot about false positives. So let's say down the road we get to a place where we do want to use these results to inform our decisions about an individual's level of risk or perhaps the level of risk of a population. We really, really have to be confident that we are not risking false positives, that we are not putting people in harm's way, thinking they're protected, and yet their body has never seen this virus. So let me finish with just 2 comments on treatment updates. To be very clear, there is still no proven treatment with demonstrated benefit in a high-quality, randomized, double-blinded, peer-reviewed journal. There just is not. The principles of our care for the sickest of the sick patients with this disease lies squarely on excellent, supportive ICU-level care to really help improve the likelihood that those patients are going to survive this disease. Nevertheless, we've heard a lot about a couple of very promising options. Remdesivir. This is an IV medication, usually given for between 5 and 10 days. And this was a medication that I think I mentioned briefly last time, is repurposed. Previously had been proposed as a treatment for Ebola. The data did not support that, but the idea is it may have some benefit here. Just last Friday, the FDA issued an emergent use authorization for hospitalized patients with severe disease for this. There was a randomized control trial that was peer-reviewed and was published last week that did not demonstrate benefit. However, there was some preliminary data that was released last week from the NIAID. The study is not yet finalized, and so the data that was released has not been peer-reviewed. But they wanted to demonstrate in the middle of their study what they had found, which included that some patients looked like they got better faster if they were randomized to the remdesivir group. So those in the remdesivir group improved within 11 days versus those who received placebo in 15 days. And there was a trend towards improved mortality. So those who received remdesivir, only 8% of that patient population died versus 11.6 in those who received placebo. So again, certainly doesn't change the landscape tremendously, but we don't have anything right now. And this is certainly looking like it may be better than what we have. I'll just finish with a couple of comments on convalescent plasma. Remember, this is an exciting concept. It's the idea that if I take an individual who's already recovered from COVID-19, so they've had this infection, they've recognized this infection, they fought this infection, and now they're better. They have antibodies in their body, in their blood, that could potentially be used as a therapy for the next person. This concept's been used in several other infections, including similar infections, such as a variety of epidemic influenza viruses, as well as epidemic coronaviruses, SARS, CoV-1, as well as MERS. The FDA did issue some guidance in April regarding expanded use access for convalescent plasma. And Cottage has been registered as a site for a few weeks with the Mayo Clinic. The Mayo Clinic is overseeing a protocol across many sites around the United States. And thus far at Cottage Health, we have approximately 8 patients who have received convalescent plasma. We have a tremendous partnership with Vitalant for our local plasma donations. And again, there are quite strict criteria that are available on the Vitalant website with regards to who qualifies to donate their plasma after recovering from this infection. So what's ahead? So just to finish up, I think some of you have heard my metaphor with regards to the tsunami and the big set waves. The first month of this locally, as well as internationally and nationally, was spent building that wall against what we feared was going to be a tsunami. And I think we all know now that it really doesn't look like the tsunami is going to hit us. Certainly not with such dramatic fashion as we saw in Wuhan, in Italy, in New York City. Nevertheless, I think it is clear that there have been some smaller waves, including perhaps even some smaller set waves coming through over the last few weeks. And I think as we move forward, we have to remember that there is the potential for some bigger sets coming through, and we have to be prepared. Some of you may have seen this from the New York Times yesterday, but the breakout of the New York City, Detroit, and New Orleans areas, which were so heavily impacted, and which thankfully are seeing a downturn. But when you remove this group and you look at the rest of the United States, we certainly don't have the tsunami, but we also don't yet have a decline. In Santa Barbara, yet another dashboard available to us and updated just this afternoon. This is on the California Department of Public Health website. You can drill down by county. Some of the data isn't reconciled perfectly with the county level data depending on times of day. But what you see here is from March until May, you see that we had a quite noisy line, at least around the time of the initial reports of the FCC outbreak, as well as some other community member cases. And then perhaps we saw some quietening, and we, in the last few days, even before the report from the FCC yesterday, there may be a slight trend towards up. Another staggering graphic, I think, here are deaths. So we don't count our deaths in Santa Barbara County, thankfully, in the dozens or in the hundreds, but we do have 11 deaths now. And when we look at the dates of those deaths, I think it's quite clear to see that we went a long time without a death. We then had a couple of deaths. We were fortunate, but now in this past 2-3 weeks, we see more frequent deaths. And of course, the last 3 days, we see a death every day. We can't talk about EPI without mentioning Los Angeles County. We are so closely integrated with them for so many reasons. Simply the overlapping community with people commuting back and forth, as well as the potential policy impacts if we were to have different opening or reopening standards from Los Angeles, and what kind of impact that could potentially have on an influx from a hot zone to a neighboring region. And of course, I think everyone has seen the Los Angeles data that is certainly not yet downtrending, and perhaps the opposite right now. So what about reopening? We turned the switch off. We are trying desperately to figure out a safe way to turn the dial back on. The healthcare industry has long worked with the CDC with regards to guidance to help us with how best to reopen or how best to respond to many infectious disease problems. I mentioned this in the last webinar, and I think it's really a fantastic resource for people, that the CDC has guidance that's really designed specifically for businesses and workplaces to prepare operationally for a reopening with excellent infection control practices. I remind everyone of the Health Officer Order 2020-8, which talked about policies and procedures for essential businesses to stay open. And that's, of course, still available on the Public Health Department website. And then I'll finish by just commenting that in parallel to the governor commenting even this afternoon on plans for phase 2 reopening and next steps, there's also anticipated to be some CDPH, California Department of Public Health, county level criteria for any counties that would qualify for accelerated reopening. And this will probably come to our health department in the next couple of days. But it's likely that the criteria will be based on some combination of recent death data, recent incidence data, and the emphasis will very likely be, and this is again instruction from the California Department of Public Health to our health officials, to emphasize these data on the preceding 2 weeks. I am not a health official. I am just an infectious disease physician. I have tremendous respect for the health officials who are working hard on this. But I understand that the initial estimates are that many counties may not yet qualify for accelerated reopening, just to be very clear. That's different than the governor's plans and guidance with regards to general reopening. But I think the general recommendation I would have would be to continue to move in the direction of solidifying plans for modifications of operation with a focus on infection control. And so to summarize, I just remind you that COVID-19 continues to cause significant morbidity and mortality around the US, different experiences in different locations. Our treatment options are limited, and we continue to rely on high-level ICU and hospital care to manage the sickest of the sick. Testing expansion has been a critically important step forward, and just tremendous news, fantastic news that our local health officials, health experts, partnering with the state and others have really facilitated increased capacity for PCR testing as recently as this week. Remember that serologies, antibody tests show great promise, but it's likely too early to use these serologies to inform either our individual level decisions or population level decisions. And finally, I want you to hear sincerely from me, we will reopen. The opportunity in the days ahead is going to be planning for modification of operations to align with safe infection control practices, but we will reopen. And with that, I will close also with a gratitude. Thank you to you all. And Peter, I'll send it back to you.
Great. Thanks very much, Lynn. That's so much information there. Okay, I just want to reiterate something that Lynn had mentioned, that I know that no business person out there or any policymaker that I know of would like to see another death in the country or Santa Barbara. And so everyone has to keep that in mind, that no one here is thinking about trade-offs. We're thinking about saving lives in the best possible way. You know, the problem is that we're all getting a little bit tired of this, and we all knew this was going to happen. Every day seems the same. Everybody's doing the same thing every day. people want to get out. And so, you know, we have to certainly be very careful. Lynn's warnings were excellent. We have to realize that it's still out there, and we have to make sure that we take care of everybody. So I call this different times, different measures. You know, have we seen this before? Well, I say kinda. So what do I mean by kinda? This is, you know, a notice that says safeguard our patients during the present flu epidemic. This hospital has restricted all visitors. The outbreak started in China, where it quickly engulfed the city of Wuhan before racing across the globe on commercial flights and ships, killing more than 1 million people, over 100,000 in the US. This was the Hong Kong flu in 1968. This is not referring to today. This is the Hong Kong flu that killed 100,000 people in the United States alone back in 1968, 69, 70. And it's something that I think we've ended up having a pretty short memory that we know these kinds of things can happen. And the more global we are, the more we travel, the more likely it is for these things to spread and spread quickly. So I think that we now know the effects of this, not just health effects, but also economic effects. The policies back then were much different in 1968. This was right during the middle of the pandemic. All the festivals were open. This is Woodstock. Nothing really got closed. Who knows how many lives could have been saved had they done some kind of mitigation. But you know, that wasn't what was happening at the time. We had another flu epidemic back in 57, 58. Some of you old folks out there probably remember these things. The one in 1957, 58 was called the Asian flu, H2N2, killed 116,000 people in the US. 68, 70 was the Hong Kong flu, H2N3, which the traces of these things are still around today. But we've seen these things before, and we've taken some measures now, but I think this is a severe warning sign that making policy on the fly is not that good. We should really prepare for these kind of things, because these things do happen, and they could happen more regularly. So we haven't seen this, though. We haven't seen a pandemic like this close the world. The world is closed like it was hit by a sledgehammer. This is unprecedented. And by the way, you can see here, I see the definition of unprecedented. See the next graphs. So this is what I mean. This is initial claims for unemployment insurance. It goes back to 1967. And if you remember, I said that in 1968, there was a pandemic that killed 100,000 people. Initial claims, nothing really happened. There was a small recession. These blue bars are recessions. And you can see that over the course of the last 50 years or so, what's happened with initial claims, they bounce around a little bit, maybe around 500,000. We're seeing initial claims now of close to 7 million. And now I'm going to sort of view what's happened over the last few weeks. Initial claims, as people might know, if you become unemployed, you file an initial claim for unemployment insurance with your state. So these are people who become unemployed who have filed. So you go back before March 14th, when numbers were like 282,000, 211,000, et cetera. That was kind of historically the average number. We hit March 21st, 3.3 million. March 28th, 6.8. Now it's been falling. Lots of reasons probably it's falling. One is the first two of these were probably all the people who could be let go very easily. Restaurants closed, bars closed, hotels were basically non-operative. This number, by the way, when we add up since March 21st, the week of March 21st until today, that's 33 million people filing for initial claims in unemployment insurance in just a month and a half. Again, unprecedented. These are continued claims. So what's the difference? Continued claims are people who have spent 1 week of unemployment insurance and have filed for another week. Those are called continued claims. And when I just showed you the earlier graph of initial claims, these people, not all of them, but most of them who filed become unemployed, and then they reclaim, and these are called continued claims. And again, you can see even during the Great Recession, we had nothing more, we didn't even have 7 million people over the course of about 2 years. In the last few weeks, you can see we now have about 22 million people who have filed for initial continued claims for unemployment. And here's a picture of what that looks like. Again, very steeply sloped here. We see that slope because of all the people who were initially on unemployment. And this is continuing to grow, no doubt about that. This is employment change. I put this graph up. It's a horrible graph, don't get me wrong. But it goes back to 1939. And what you can see is, this is World War II, the end of World War II. Employment dropped precipitously, the largest we've seen, pretty much ever. And then you can see what's happened over all the recessions. Here's the Great Recession here, where we saw drops of about 800,000. This is what we saw last month from the Bureau of Labor Statistics. 701,000 was the employment drop. That's nothing. The reason I wanted to show that is, and this is what it looked like sort of historically for going down 701,000 last month. So what's in store? So what do we expect to see? Well, if you don't like seeing bad looking things, don't look at the next graph. The Bureau of Labor Statistics employment report comes out tomorrow. It comes out the first Friday of every month. It's going to come out tomorrow. What's likely to happen? Well, we happen to have something called automatic data processing, which is a company that processes employment pay. And here's what they reported yesterday. So this minus 20, by the way, means 20 million. You can see what's happened since the Great Recession. Maybe we lost, as much as 2 million people, et cetera, at the most. It's kind of hovered around here. This is what we're going to see tomorrow. We're going to see a loss of employment of about 20 million people. Again, never before have we seen anything like this, in the history of the United States. So it's something that most people are expecting. Most economists understand it, and I think it's something that's going to be, devastating, as we've already seen. So back to opening, and we hear a lot about this. It's a major controversy. And as I said, no one wants to see anybody else become sick and die. But how do we reopen? And as I mentioned at the outset, we close the economy with a sledgehammer. And this is not how it's going to open. It's not going to open with a sledgehammer. It's not going to all of a sudden say everything's open. We need to think how to open safely. And we need to think about how to open with a scalpel. That is, we have to really look and see what places we can open safely, that are virus safe to open, that are going to not infect other people. However, we're going to get people's lives back. And by the way, this is super important. And the reason being that there's lots of evidence that being unemployed for months and months leads people to despair, opioid addictions, possible increases in suicides, alcoholism, you name it. And I'll show you something in a second. So what do I mean by that? What I mean by a scalpel is not all restaurants are the same. There are some sit-down restaurants. They'll have to be treated a little bit different, possibly, than just takeout restaurants. Retail stores differ. How do they differ? Hardware stores are probably different than clothing stores, then are different than other types of stores. Hotels and motels. There are self-service hotels, selective service hotels, excuse me, that don't have conference rooms, that don't have spas, don't have pools. They're much different than places that have spas, pools, resorts, etc. Those things are all different. And so I think what this scalpel has to do is say, look, these things can control a little bit better than others, and we have to make sure that everyone does that. We maybe have to think about making sure that those people who are at risk with health status or age are also protected. So this is, whoops, my bad. This is a picture from the Lancet, the British medical magazine, and basically what this is, you can see up here, this is the infection fatality ratio. This is age over here, and the point of this is these differ tremendously. So you can look at between 0 and 9, the adjusted fatality rate is 0.00161%, 10 to 19, 0.0069, 20 to 29, 0.03, 30 to 9.08. Won't go through all of them, but you can see once we get to 60 to 69, this is 1.93%. This is 2 people out of 100 if they're infected that potentially die from this disease. This is 2 out of 100. That's a lot. And you can ask any infectious disease person, if you get to that stage, we better do something very, very strict. You look at people 70, 79, goes up to 4%, and then almost 8%. So that's what I mean, that we have to be really careful about who it is we want to have out there. And I think most economists that I know who are working on this, they basically all recommend that we have to change the way we've done this, that we can, for example, what if we tell everybody can go to work except for those over 65? How do we stop them? We can pay those people over 65 not to go to work, for example, just like now we're paying almost everybody not to go to work. Instead, we could pay a much smaller part of the population, which would save the government lots of money, and we'd save a lot of lives. So how do we think about going forward? Well, Lynn mentioned a lot about testing, and that's going to be super important for all of us. This is something that we really have to get our policies leaders to get us to test a lot more, get the facilities to do that. We need to maintain social distancing. We need lots of creative ideas. So this is what we're worried about, at least many people are worried about. So remember I mentioned the Hong Kong flu in 68 to 70. It had 2 waves. The orange is the first wave, the black is the second wave. As you can see, in England and Wales, the second wave was much more deadly, more than 5 times more deadly than the first wave. In France, the same thing was true. Australia, the same thing. In the US, luckily, it was not as bad. I'm not sure the policies that were in place at the time, but we want to avoid the second wave that could possibly be devastating once again. So what kinds of things can we think about? Well, remember, this has far-reaching effects. I just read this thing today in Forbes. 40% of mothers with children under 12 are experiencing food security. That's only going to get worse the longer people are out of jobs. The opening is going to be slow. It's going to be slow for lots of reasons. The governor today announced the new budget deficit at $54 billion. In January, it was a $5.7 billion surplus. This is going to hurt everyone, our communities, our public services, etc. Opening is not going to be driven by the government. Opening is going to be driven by consumers. If tomorrow the government said everybody can go back to wherever they were doing, I'm not sure how many of you would decide to be on an airplane, how many of you would decide to go to movies, try on clothes, you name it. Who knows when that's going to come back? But businesses also don't want people to be sick. They're trying to run a business. They're going to make sure, and they must, make customers feel safe by doing all kinds of things. So here's one that I saw today. This is an outdoor restaurant in the Netherlands where they've built these little, I mean, this is thinking out of the box, I wanted to say, but actually they're in the box. So this is a greenhouse where it seats 3 or 2, up to 4 people. They sit out there, they eat, they're separate from people. And I'm on the mayor's council for reopening, and they're thinking of lots of ideas. They're very creative right now, and I really encourage anyone to make sure that you talk to your the public officials. And that's it. Thanks very much. So next, I'd like to introduce Joanne Funari, who's the Executive Vice President and Chief Operating Officer of American Riviera Bank. Joanne?
Yes, thank you, Peter. And before I get started, I'd like to, on behalf of our team here at American Riviera, we so much appreciate all the healthcare workers, all the first responders. I echo the comments that Lynn and Peter had in regard to we do not want to see anyone else. We don't want to see the deaths. We don't want to. We really, really want to open slowly and thoughtfully. And but at the same time, we do know, and we have worked with a lot of businesses, a lot in the last couple of weeks, and they are suffering. So with that, I would like to talk a little bit about, I'm going to talk about the acronym of the day, PPP. And Peter asked me to provide some updates and insight on the PPP program. So I thought the best way to do that would be to address some pertinent statistics and to outline the challenges that we face, that we still face relative to the program. I was just one of many of our incredible team members at American Riviera that actually worked with each PPP applicant. So most of my discussion today is going to be from the customer's perspective. Next slide, thank you. I just want to reiterate a little bit, overview of the PPP program. Most of this you've already heard, so I'm not going to waste your time and go through it again. But there are a couple of things that you haven't heard, and that is mainly the impact on resources. Many community banks have processed and approved over 2 times as many loans in the last 30 days as they have for an entire year. So that's a lot of work. So, but everybody's happy to do it. Everybody's working hard, and everybody really wants to support our community. In addition, one of the things you may not know is that once you receive approval of that loan, once you receive SBA approval, the bank has 10 days, only 10 calendar days, to document and fund that loan. And that's going to be really important in a minute or so when I get to some of the issues around that as it relates to the customer. So I'd like to go to the next slide, please. I want to go over some stats because this is really important. It's important to know that people are getting the money. It was very, at the very beginning, it was pretty turbulent, I must say. Guidance was changing constantly. It's still changing. They're still refining it as they go. But for the most part, I mean, the money is getting out there. So I want to look at the national stats first. This is a quick snapshot from SBA, and this shows the stats from round 1. Now, round 1 was the first stimulus that went into the PPP, totaling $349 billion. And then the second stimulus, which was the second round, came in at $310 billion. You'll note that in round 1, based on this slide, the majority of the applications funded were under $150,000 each. While in round 2, the majority of the applications were under $50,000. So you can see that the smaller businesses, they're coming in and they're getting the PPP funded. In round 2, SBA tracked, if you look at that bottom portion, in round 2, SBA tracked the bank size and noted that banks under 10 billion in assets participated in round 2 quite a bit. And this is the category where the community banks fall into. And from our standpoint at American Riviera, we processed as many loans in the first round as we did in the second round. Can we go to the next? Yeah, perfect. Okay, this slide is very interesting. These are the stats by state. What I did is we took the top 10 states. We have stats for every single state, but I couldn't possibly fit them on this PowerPoint. So we have the top 10 from round 1 and the top 10 from round 2. So you'll see that what's interesting is the top 3 recipient states in both rounds were California, Texas, and New York, representing about 24% of the total PPP allocation for each round. California being the highest of all states by quite a bit. Next one, please. Excuse me. Okay, I want to get to the stats. So those were the national stats. Now I'd like to talk to you a little bit about what we did locally. And I'm trying to find out, you know, I'm trying to talk to other banks to see what they've done, and some are publishing their results and some are not. So, so I can only speak for American Riviera, but we funded 577 PPP loans totaling $115 million. And our smallest loan was $2,375, and our largest was $2.4 million. We help support almost 12,000 jobs in our communities, which is phenomenal. And the industries that we supported reflect our marketplace: restaurant workers, construction, real estate workers, dental offices, doctors, law offices, sole props, and schools and nonprofits. And I might add now at this point, though, that American Riviera Bank just received an indication that we're #1 in SBA rankings as the #1 SBA lender in San Luis Obispo County and Santa Barbara counties. And that was as of February 29th. So we're pretty proud of that. Okay, so some challenges. Okay, so yes, people are getting the money, and that is terrific. We're very, very happy about that. Now, couple of things that have happened, and we have been in pretty constant contact with Congressman Carvajal, and have followed up with his office in writing, and they've been responding. And I got a response on a couple of these questions actually about an hour ago. So we are really actively pursuing, we're listening to our clients, and we're pursuing these things. One of the things that had come up a lot is, you know, you're hearing about all these large companies that qualified for PPP on the first round, and they took the money. Ruth's Chris, Shake Shack, and the question is, you know, so they sent it back after they've had it for 2 days. They sent the money back, but it did not replenish the fund. The money did not, it just simply wasn't available anymore. And so it did not replenish that fund. So when we talked with the congressman, basically it goes back into the federal coffers. It's a loan payback, and they plan to potentially use that again in a third stimulus package. And I'll get to that in a minute. Another and very pressing issue right now is going back to we have to fund the PPP loans within 10 days of it being approved by SBA. Okay. Now, once you get that money, you have 8 weeks. That's it. You have to pay your employees for the next 8-week period. And many of these businesses, and when you look at Governor Newsom's 4-stage plan for re-entering the workforce, this is the struggle. A lot of these businesses will not be open or may not be open until late summer. So they're spending this money now on employees. But what happens after that? Most businesses cannot last 4 to 5 months without revenue, with zero revenue stream. And so that's the struggle. And so we really, we've really been pounding on that issue with Congressman Carvajal. And basically what they're looking at right now is, we've been told today, and this is probably out there, it's probably been out there for a little bit, but they're looking at CARES 2.0. And it's being negotiated right now, and Congressman Carbajal is the co-sponsor of the PPP Extension Act in that bill, which would approve $900 billion for the PPP program. And he is committed to supporting small businesses throughout this. He has stressed that. Let me just see right here. Excuse me. So the PPP Extension Act would extend the duration of PPP through 30 days after the end of the COVID-19 National Emergency Declaration. So these are things that are not out there yet, but these are things that are being negotiated right now. It would also, the extension, would also allow SBA to grant extensions to existing PPP loans without an additional application by the business. Now, we've also heard some talk from his office about, we're trying to get them to understand that once the 8-week period, once they've spent the money, they've spent the money. So it has, they can't, if it's renewed, that's great, but they still have zero revenue coming in. So, they're looking at a process of, after 8 weeks, go ahead and what portion is able to be forgiven would be forgiven, and then the bank can redo the loan, not redo it, but actually replenish it for another 8 weeks. So it would be 8 weeks at a time. So these are things that they're looking at. And then of course authorizes an additional $900 billion for PPP, which is pretty amazing, and will certainly add to Peter's to the deficit that Peter referenced earlier. Okay, so my next slide, and one of the things that is still a challenge and people ask us about all the time, is the forgiveness. And what does that look like? Now, really the only thing that we have at this point that's somewhat substantial is the interim final rule that was issued right at the outset. And it did talk about the area of forgiveness, and where the majority, bottom line is, the vast majority of what comes out of that PPP has to go to payroll, and has to be used on payroll expenses, and bringing your employees back or paying your employees. And again, that's the struggle. Many restaurants, for instance, have had to, they're paying their employees because they have the PPP, but they're not going to be open. So we are still awaiting final defined guidance around that. But things that this slide also talks about, some of the things that you'd like, that you really should be focused on and continue to gather through this period, so that you have all of the documents that you're going to need to certify to get that forgiveness. And we have this information on our website as well. But I believe this slideshow, this PowerPoint, will be available to everyone afterwards. Okay, next slide. I also wanted to talk about a little bit about the Governor Newsom's phased-in plan for getting back to work. The first slide, and these are my last few slides. The first slide gives you a high-level perspective of his approach, and the next couple of slides address the business types that will be allowed to open within each phase. Now, this ties into my earlier comment about how long businesses last with zero revenue. when you look at the next slide, stage 2. Okay, so stage 2, which I think Peter and Lynn referenced, may be going back slowly and safely, but going back as soon as tomorrow. And if you go to the next slide, stage 3. So stage 3, these are a lot of our retail people. These are a lot of, you know, we've got hair salons, we've got gyms, entertainment venues, and these people in the 3rd stage, about 3 or 4 days ago, were told they may not even get back to work until the end of summer. So that ties right in to what are we going to do after the 8 weeks? And so we feel that's a very strong issue, and we're going to stay on that. We're going to definitely stay on top of that one. And can I get the next slide? Yeah, thank you. And I think that Kristen Miller, who's going to be talking shortly, has some really great, innovative things to share about some businesses that really changed and changed their processes to support areas that are needed with the COVID-19 now. Hand sanitizer, thermometers, and so Kristen will talk more about that. But that's it. I want to thank everybody so much. And Peter, back to you.
Great. Thank you so much, Joanne. Again, so much information there. It's so hard to digest. And, you know, so next we have Kristen Miller. Kristen is President and CEO of the Goleta Chamber of Commerce, who many of you know has recently merged with the Santa Barbara Chamber. Very exciting. Anyway, Kristen.
Thank you very much, Peter. I am, as he said, Kristen Miller, and for the past 18 years, I've been the president and CEO of the Goleta Chamber of Commerce, representing 450 businesses and 35,000 jobs in the region. As of a few weeks ago, we have announced that I will have the honor of working with our neighbors at the Santa Barbara Chamber of Commerce in a merged organization. The expectation is that this new group will represent more than 1,000 members and many more jobs, but the work of that is still unfolding and evolving, and I hope to be able to bring even more value to the region as the voice of business going forward. Details, titles, even a name of the organization will follow. COVID-19 and the rapid onset of the hit to our economy made many decisions that businesses and chambers of commerce were contemplating urgent. One was to speed up the merger of our organizations. The other is that every single aspect of our operations and our program of work changed. We recognized immediately that restaurants were one sector of small business who would be most affected and most likely to go out of business. Chambers of commerce and many organizations became full-time advocates for restaurants. This is certainly because we each have our favorite: noodles, Uniboil, sushi, tacos, burgers, pizza, and seafood. But in reality, we collectively realized the potential long-term detriment to losing this part of our economy. Especially in Goleta, the loss of even just a handful of restaurants, say 5, and a coffee shop with real vibe would have lasting negative effects to our much esteemed quality of life. It would even have negative effect on our industrial core businesses, as one of the biggest objections we have had to growing a high-tech business in Goleta is, where am I gonna have lunch? So work with restaurants to stay in business and to plan to reopen is ongoing, from state programs to federal funding to grassroots campaigns. At the Chamber, we did write a grant and loan program and pitched it to the city of Goleta. Goleta is small enough that we could make a list of restaurants, plan for a small grant or loan program, and ask for an investment amount that would make a real difference. but we're finding that there isn't a good mechanism to connect business and government on something this quickly. And with social distancing, we can't have a roundtable meeting to debate and discuss it. This program is still on the table if anyone out there has a great idea. This led to our other attempt. We took steps to try to implement a task force, similar to what the city of Santa Barbara did, to connect business and government during the crisis. We thought it would be helpful to gather representatives from the major retail centers, then someone from manufacturing, technology, commercial real estate, and others, and put them together, virtually, of course, with decision makers in high levels of government to convene so that we could address the economic crisis that was unfolding. We floated this both to Goleta and to the county, but found that again, under these immensely trying circumstances and an ever-evolving crisis, it proved very difficult to achieve. I have more on this later, but I'm giving you a glimpse right now at the behind-the-scenes progression of our business-related problem solving. Continuing the theme of how do we stay together while apart, we did implement a weekly business leadership call, gathering representatives from each of the important sectors of the economy to each give a short update from their corner of the crisis to their colleagues and representatives from government in a timely and consistent schedule. This has proved to be a useful tool, and the feedback we receive is that we will keep doing this, but keep evolving it for the foreseeable future. And we were able to convene a similar group county-wide. CEOs from each Chamber of Commerce in the county now gather weekly instead of monthly to share best practices, emerging trends, new information, and our regional perspectives. What we've learned through both of these groups is that businesses in our county are doing an amazing job of innovating during this time of crisis. Manufacturers are keeping lines open while distancing employees and using new sanitation protocols. Retail has changed curbside pickup into a fun new normal. Restaurants have adapted to creative strategies that keep safe distance and give their customers confidence in their practices. Software companies have learned to work from home. Banks have modified their strict guidelines to somehow become even more customer friendly. Some of our favorite gathering spots like local brew pubs and the zoo have found a way back into our hearts through Zoom, GoToMeeting, and Facebook Live. I'm not minimizing the fact that many businesses are closed. Healthcare workers are either overworked or can't work at all, and that we customers are suffering too from home haircuts and new levels of loneliness. But I do want to recognize that we seem to adapt quickly and creatively, and many of our businesses have invented new ways to keep going where they can. Going from the big picture to some very tactical work, we found ourselves in a unique position to purchase 20,000 paper masks. We found that we could tap into the supply chain for masks that were being provided to our high-tech clean rooms and procure them pretty quickly. We calculated a formula of how many retail establishments were open, estimated their number of employees, and decided on a number of masks that we thought we could provide coverage for 3 weeks. Just in Goleta and just to businesses, we narrowed this project to those audiences because we felt it was an audience we could support safely. And these are the members and businesses who know us and who are already connected to us. So where are we now? That's a high-level recap of the past 6 weeks, and I'll try to illustrate a high-level picture of where we are now. The Federal CARES Act, the National Relief Funding, and particularly the small business funds that Joanne just so eloquently described, have been the necessary lifeline to our businesses locally. It is by far the quickest, largest, most comprehensive business relief package we have ever seen. We didn't see anything like this during the Great Recession. It may not be perfect, but it continues to be the first line of defense for most businesses, and the fact that it goes through our local community banks has been the best part, as these are our long-term community partners and they know our businesses inside and out, especially now. The County Board of Supervisors connected with REACH, an excellent economic development group, to help us connect business to government in a way similar to what I described before. REACH has done a fast-paced, thorough, and nimble business input process this week to provide feedback to the county this Tuesday. Their outreach process has brought us together and connected businesses with each other across the county to share our best ideas and plans for reopening business in the most efficient and safe ways. Phased reopening of our economy is the most important work we are doing right now. And coordinating that with allowing travel again and how that affects our tourism economy is of highest importance. Every area of our county is reliant on tourism in some form, and most cities count on bed taxes and related tourism income as their largest source of revenue. Many of them also invest in their local tourism industry businesses through their Chamber of Commerce, Tourism Business Improvement District, or Conference and Visitors Bureau. The city of Santa Barbara has certainly been a shining example of doing this well. And so while this industry cluster is facing the most devastating economic crisis of our lifetimes, our municipalities will suffer the financial loss as well. Our concern is that this loss eventually strengthens the relationship between cities and the county with those businesses and heightens the awareness that government's investment in economic development related to visitor services is a key piece of our economic strategy for the future. The loss of this revenue will affect us all for some time to come, and we will be championing future partnerships to strengthen the investment in this area when the time comes. Also, in the big picture category of where we are now is a recognition that we are a bit lost. We're doing the best we can. We are humbly and hesitantly trying to survive and thrive without a roadmap or a timeline. I wish we had done a little more to plan for an economic disaster. No one could have predicted something of this magnitude, but I can't help but think about the hours we have spent preparing for fires, floods, and earthquakes. We've spent years doing disaster preparedness for business. We've prepared, practiced, raised money, run drills, and most importantly, we made protocols and plans so that during a disaster, we follow our plans and make quick decisions based on a set of guidelines and not react, not make decisions out of panic or fear. During a disaster, we activate relationships and we rely on data that we agree on in advance. But now, during an economic crisis, we seem to be making it up on the fly. I don't mean to be too critical. We all know hindsight is 20/20. Businesses, chambers, city, county, just about every other agency are working tirelessly to try to manage without a plan. I think we are all suffering from some gaps. I sincerely hope there is not a next time. But what would be helpful in the future is to have some established protocols to connect business and government. More than tightening and loosening regulations, we should be doing crisis management about the one thing that keeps us inexorably connected, the economy. Business suffers, government suffers, but we are still working on ways to connect and feel confident that we can pull together on a plan for action and recovery. I'm certain that we can be a good partner and help make this a long-term goal. And lastly, in the where we are now category is that we're facing the deciding moment about many, many summertime community events, including the 4th of July fireworks show that so many communities present. In Goleta, we're almost ready to announce that we can do an Independence Day fireworks show without public gathering, so no festival. But every business and community is facing the uncertainty and not knowing how to plan for our most treasured and historic community events, activities that have traditionally brought us together in festive celebrations. Oh, there's my 4th of July slide. About recovery, we have relied on the UC Santa Barbara economic forecast for more than 2 decades to give us the best information possible on projections of the local economy. I don't have any of those skills, but here's some of what I'm gathering from volunteer leaders in a variety of industries. The new normal will and should be very different than what we had before. The CEO of California Forward said it this way: we should not be working toward economic recovery. We don't want to recover the same mechanisms that led us to this. What we want is economic renewal, determining how we can do things differently to get different outcomes. As we look toward the recovery stage, which I recognize we are not in yet, our rallying cry may be to work far more closely together, less silos, more connection. Our chamber merger may not be the last. Organizations can and will be uniting to pool resources and brain power and community action to truly come together as we pull through this economic crisis. Retail, restaurants, and commercial real estate will surely evolve and change for a better future. There can be a win-win when we combine more uses onto a site like the Funk Zone or Public Market as examples. When we modernize our downtowns to be more habitable environments, when we allow more workers to telecommute, and we have access to healthcare in the palm of our hands on a smartphone. We are smart, innovative, compassionate people, and we have learned more than ever that we thrive in our tribes. We need each other. We miss being together. So when recovery comes, we want to use our collaborative spirits to make necessary changes that allow the new normal to be better than it's ever been. I can't wait to see you all in person again soon. Thank you.
Great, thank you very much, Kristen. Now we have a little bit of time left for some questions. I'm going to turn it over to Travis, who is the moderator of the questions, and will ask panelists some of the questions that have been submitted.
All right, thank you, Peter. Before we get started, I'd like to remind/plug the fact that we are doing, the EFP is doing a survey, and Daniel Cullen is going to post a link to that survey. So if everybody could go do that, it helps us out a lot. But without further ado, let's jump into some questions. I've got about 2 for each person. The first one is for Lynn, comes from Ed Kaufman. And I actually had to do a little bit of Googling about this because I didn't recognize the word at all, but he asks, have you seen any children with Kawasaki in Santa Barbara? So I guess the question is, what is that? And why is it related to COVID?
Sure. So it's a really interesting question. There's an inflammatory disease in children, can cause very, very severe disease and hospitalization called Kawasaki's disease. We've long looked for an infectious trigger of the disease. The disease causes high fevers, rash often, sometimes aneurysms actually in the coronary arteries and problems with the heart. And just in the last 48 hours, or perhaps a little bit longer, we've heard this cluster of reports out of the New York area, as well as now around the country, describing pediatric cases who were confirmed to have COVID-19 disease and who had it's not been identical to KD, but a Kawasaki's disease kind of spectrum illness. And so one of the questions, and I think really as it pertains to probably our audience here today, is I think just thank you for the question. I think the point is a very good one, is that as we have larger and larger volume of people exposed to this, it's obviously more complicated than simply saying kids don't get it that bad. And tragically, it looks like there may be a manifestation in a very unfortunate, but hopefully incredibly small subset of children that have this inflammatory manifestation.
Gotcha. Next one comes from Scott Steffen. Would you say it's unfair to compare, this is for Peter Rupert, would you say it's unfair to compare the COVID shutdown to the Great Recession? The Great Recession was self-inflicted with bad business decisions. This is external and not the fault of most people who are affected.
Yeah, that's a great question. I think that this is very different than the Great Recession. This is very, very different than any recession we've ever had. This is a complete shutdown of basically every industry that we know of. Typical recessions might have some industries shut down. It might be a wealth recession, et cetera. This is not a recession. This is not like people don't a lack of aggregate demand, that people don't want to go out and spend. Well, first of all, they don't have money to spend, and secondly, there's no stores open to have to get to spend. So, you know, the idea that we're transferring money to people, you know, in hopes that $1,200 here or there, while it's a lot of money for a few weeks, if this continues for 4 to 6 months, this is going to be devastating. It's not like we have to increase consumption a little bit and get back to where we were. This is going to be slow, and it's going to be affecting people for a long time.
All right, our next one for Joanne comes from Rob Mangus. The employee retention credit shows 2 employers as exceptions, state and local governments. Is that true of paid sick leave and family leave credit program? If so, is there any indication that the exceptions may be changed to allow the credits for state and local governments?
Okay, I don't know that I understand the question fully, but I think what he's asking is if it's eligible under something like the PPP program, and they did get reimbursed for it, they cannot double dip in the other areas. So that is definitely prohibited. If that's where I don't know if that's where he's going, but
I think so.
Okay.
There's also a follow-up or a similar question from Carl Hutterer. I have heard rumors that there are discussions underway in DC about possibly extending the period for using the loan, I believe the PPP, beyond 8 weeks. Do you know whether this is any substance?
Yes. Yes, actually. Yes. There's. I think it's a little more than a rumor. This is one of the things that is they're negotiating right now for CARES CARES 2.0. And this is something that Salud Cabral has been working on. So we will, as we get details on that, we will definitely post it on our website. So you can check that periodically, and just know that we're on top of it because we know it's an issue.
Next for Kristen, Sherry Jasinski asks, can you talk about contacts tracing, but I'm going to beef that up a little bit. Is there any sort of word from your end of things on perhaps official systems being put in place to keep track of individuals as we begin going through the phases of opening up?
Did you say for Kristen? Because that wouldn't be for me.
Yeah. Do you know anything about any official situations as far as that's going on?
For contact tracing?
Yeah.
Gosh, no. I mean, I'm reading about that just like everyone else. And
Gotcha. Anybody else have any thoughts on that in the Santa Barbara area?
I can comment generally. I mean, I think our public health department does a tremendous job all the time of contact tracing related to communicable diseases. Tuberculosis is a classic example, and they've really been working round the clock for now weeks, contact tracing related to all of our positive cases in our community. What I think is different, again, I think people have been able to read this themselves, but what I think is really different about this is the opportunity to perhaps leverage the amazing tech opportunities we have with regards to contact tracing. And that's, I mean, that in and of itself is a very, very interesting, webinar of, that could take 90 minutes to talk about. I think the thing to remind everybody for this week is that the public health department has actually put out a general call requesting help. They're taking applications for people who want to really participate in this effort. You don't have to have training. They really want people who are eager, interested to help, and there's an application process online for that.
Next one's for Peter from Joe Cooper. Will Santa Barbara suffer more with loss of income and higher unemployment and so forth than the rest of California or the United States more generally, given our reliance upon food services, tourism, retail, and transient student populations?
Yeah, I think that some of the hardest hit areas have been leisure, hospitality, retail, and we do rely a lot on that. In relatively speaking, in terms of how much more, it's not that much. I mean, when you look at California as a whole, our leisure and hospitality and retail sector combines, added up a little bit more than 4 or 5% more than the state as a whole in terms of employment. So we are going to be a little more affected, yes. And again, as Kristen mentioned, tourism is a big deal, and so Travel is going to be, an issue. I think we'll see more people coming up from LA, for example. But yeah, we will be a little bit more affected, but I don't think too bad.
Okay, one more for Lynn. This is again from Ed Kaufman. So setting aside whether the presence of COVID antibodies confers immunity, what performance attributes do we need in a COVID antibody test for it to be useful? I remember, I think I saw something on John Oliver the other day where they described the antibody testing as like right now in the wild, wild west. So do you have any thoughts on that?
I've always loved John Oliver. I agree with him. Great question. So I think that the point is well taken, which is other infectious disease folk and other public health folk are saying the serologies are not ready for prime time. And the question is, well, what needs to be true for that, to no longer apply? I think that as you pointed out with the preface to the question, the most use an antibody test will have is actually if we can confirm, or when we can confirm, that positive antibodies equal some level of protection. Now that protection doesn't need to be perfect, but we have to have some way to correlate that a positive antibody test actually means something practical going forward for that individual. In addition, it's really just a virtue of the biostatistical kind of exercise of a disease for which there is a very low prevalence, like this may be in our community right now. And by low prevalence, we can argue over 1% versus 5% having been exposed to this. But all these numbers are low. This is not that half of our population has seen this virus yet. And when you have a low prevalence disease, you really, really are vulnerable to the problems with false positives, unless you have a nearly perfect specific test. And so I think to answer your question, I think what we really want, what I'm yearning for, is data that is produced by someone external to these companies, so an academic institution, someone really without skin in the game, to tell us that they have looked at a big, big set of data. They believe that some of the patients in that big set of data were previously exposed to other coronaviruses because perhaps it's a big enough data set and they knew human coronaviruses were circulating in that community. And they still know that only people that were positive were people who had previously confirmed to have disease. They also want to be able to, we need to be able to rely that if it's negative, we can rely on it being negative. And so that's, I think, what we're ultimately looking for. I'm optimistic. There's a lot of reason to believe that these answers will come. I'm anticipating it will be 3, 4 weeks, 5 weeks before we really have anything we can hold on to.
All right, and being sensitive to the time, I think we've got time for one more. This one's from Mitchell White. I'm going to direct it to Kristen, but the question specifically about downtown Santa Barbara, I'm actually going to broaden that to include Goleta too. But the question's as written is, downtown SB was already experiencing an increase in vacancies before the pandemic, with 2 other businesses already having announced that they're going to close for good. What type of impact, short and long term, is expected along this corridor? So broadening that to Goleta, are we aware of any sort of permanent closures in the Goleta situation that we might be worried about long term?
I don't know if I want to speak to specific closures, but certainly the premise of the question is this going to get worse? And it was already bad, and I agree with that. Yes, it is going to get worse in both communities, and probably all communities in the county. But as I was trying to speak about, I do think once we deal with the public health issues and find innovative ways to reopen in safe and small steps, there are economic development opportunities to redesign things to be a little more resilient in the future. And I think our beloved downtowns in every community are job one, because that is where we feel our community, that is where we feel connected, that is where we experience our connectedness. And a lot of work should be done to bring those back as the hearts of our communities.
Okay, great. Thanks so much. Thanks for all your questions. Thanks for joining us. You can find us on the website at University of California, UCSB EFP website. The slides will be there as well as this recording. And I want to thank all the panelists and again, the sponsors, and tell everybody just stay safe and we'll get through this. Thank you.